Hi, my name is Trevor Maughan. I'm a local Medicare specialist here in the Boise area. I work for Insurance Source of Idaho, and I'd like to thank you for tuning in here to my Medicare 101 session. I really hope that you can get something out of this, and hopefully I'll be able to answer some of the questions that you may have about Medicare. So let's get started here with my presentation. I will share my screen. So just getting started again, like I said, there's my name and contact information. If you have any further questions, always feel free to reach out. Let's get started here. So our meeting today is purely for educational purposes. It's meant to better prepare you for the Medicare process and the decisions that you'll need to make here as you come up on starting your Medicare. Quick agenda layout here. We'll start out talking about original Medicare. We'll go into Part D, prescription drugs. We'll then move into Medicare Advantage plans and talk about some of your choices. And then we'll end talking about your Medicare supplement choices. So let's start out talking about original Medicare. You can see there the red, white, and blue Medicare card on the right. But what is original Medicare? It's a federal insurance program run by the Centers for Medicare and Medicaid Services, also known as CMS. It provides health insurance coverage to people who are 65 years of age and older, also for those who meet other special criteria. So eligibility, who's eligible for Medicare? You're probably familiar, seniors who are 65 years of age and older. Those who are under 65 that have certain disabilities are also eligible. Anyone who's any age that has end-stage renal disease, and also anyone who's any age that has ALS, Lou Gehrig's disease. So that's the eligibility for Medicare. Your choices as a Medicare beneficiary. Eligible or soon to be eligible for Medicare. You'll want to know what Medicare covers, learn about the options that you have as a Medicare beneficiary. You may need more coverage than Medicare alone provides, so we will go into that and talk about some of those options. Original Medicare only covers about 80% of your medical and hospital expenses. So you're responsible for the following: paying the remaining 20% of your medical and hospital costs, 100% of your prescription drug costs, and like you see, original Medicare wasn't designed to cover all of your expenses and doesn't include prescription drug costs. So parts of original Medicare, you've probably heard about all the different letters, A, B, C, and D. But original Medicare consists of only just Part A along with Part B. So we'll start out here with Part A. Part A helps cover your inpatient care in hospitals, including critical access hospitals and long-term care hospitals. So in 2020, Part A had a deductible of $1,408 per benefit period. So each time you're going into the hospital there, you've got that deductible. Most people automatically get Part A without having to pay a monthly premium. So it ends up being free for most people. Part A does. Going into Part B, which is the medical coverage, like it says, it helps cover medical expenses like outpatient care when it is medically necessary. Most Medicare beneficiaries, unlike Part A, Part B will have a premium that goes along with it. And most pay the standard premium, which comes out to $144.60. You may pay more based on adjusted gross income, or less if you're paying through your Social Security benefit, or if you qualify for extra help. But normally that standard of $144.60 will apply. And then at the bottom there, as you see in 2020, you pay your 20% for your medical coverage after you hit a $198 annual deductible. Moving on to some optional parts of original Medicare. So A and B make up original Medicare. We'll talk now about Part C, which is Medicare Advantage. Medicare Advantage, or Part C, is provided by independent health plans who have a contract with Medicare to administer Medicare Advantage plans. So these Advantage plans include all of Part A and Part B, and also provide you with some extra benefits that original Medicare doesn't provide. And this may include some dental, vision, hearing, just additional benefits like that. Moving on, and then like we mentioned, Part D, which is the prescription drug plans. So Part C and Part D can help you pay some of the out-of-pocket costs not covered by original Medicare. For some plans, you pay a monthly premium, and they are health plans offered by private insurance companies approved by Medicare, like we said. Private plans provide Part A, Part B, plus extra coverage, and you must continue to pay the Part B premium plus the plan's monthly premium. So you'll still have that $144 and change from being in the Medicare system through Part B, and there may be an additional premium to add a Part C. Even though there's many Part C plans that are as little as $0 to add on, but just know that you may add on a few dollars there from a Medicare Advantage plan. So Part D, prescription drugs, prescription drug coverage. It's designed to help lower your prescription drug costs. It's available as a standalone plan or may be included with a Medicare Advantage plan. So a lot of the Part C Advantage plans have a Part D included in the bundle, which is really nice. As far as a standalone Part D plan, it can only be purchased if you have original Medicare only. So if you don't have Part C or a Medicare supplement plan, it cannot be purchased with the Medicare Advantage Part C plan. But like I said, a lot of the plans do have that Part D included. The enrollment periods for Part D. So it can be purchased during the annual enrollment period, which is October 15th through December 7th, or if you receive Medicare benefits because of a disability. Generally, you can buy Medicare Part D after you're on Social Security disability for 24 months, so for 2 years. And you can make changes to your prescription drug coverage yearly during the annual enrollment period, which, like above, runs October 15th through December 7th. And so that's your time slot there to make some changes to your Part D drug plans. So we'll talk a little bit here about how it works, how the Part D works. So generally, the plans will have a list of their covered drugs, and so that's a big thing, is we'll want to make sure that your drugs are, number one, covered, number two, how they're covered. Make sure that's going to benefit you the best it possibly can. And here are the Part D prescription drug coverage stages. We won't go too much into detail on this, but you see the stage 1 through 4. Stage 1, you have an annual deductible. Deductibles vary between $0 and $435. So once you hit that deductible, then the drug plan will kick in. So you see stage 2, which is your initial coverage period, where you're responsible for a limited copay or insurance. You'll pay a small amount until you reach $4,020 in total drug costs. That'll vary on the plan a little bit. Once you hit that $4,020, you enter stage 3, which is the coverage gap, where you're responsible for a larger copay or co-insurance until you meet the true out-of-pocket costs. So in most cases, it says you'll pay 25% for covered generic drugs until you hit $6,350 in true out-of-pocket costs. The amount paid by the drug manufacturer combined with the 25% you pay will count towards the out-of-pocket costs. So once you hit that $6,350, you'll get bumped down to the catastrophic coverage, where you're responsible for a limited copay or co-insurance. So there you'll pay the greater of either the copay, $3.60 for generics, $8.95 for all others, or a 5% co-insurance for the remainder of the plan year. So you'll start out there hitting your deductible anywhere between $0 to $435, and then once you hit that, you'll be in the initial period, paying a small amount, copays, things like that, until you hit the $4,020. Then you'll get bumped down to the coverage gap, where you will pay a little bit more until you reach the $6,350, where you'll then bump down to catastrophic coverage, where you'll pay a little less. Time for a quick poll. And so let's now go on to Medicare Advantage plans, Medicare Advantage options, just to help you understand the options available to you. You may want additional coverage to help you pay some of the out-of-pocket costs not covered by original Medicare. And so hopefully this will help you be better prepared to make the right choice for your situation. Medicare Advantage plans contract with the federal government to provide multiple parts of your Medicare benefits in one simple plan, including additional coverage you may need. And like we've said, many Medicare Advantage plans also include the Part D prescription drugs. So Medicare Advantage plans, we have original Medicare, A and B, plus Part D, plus extra benefits. And so the Medicare Advantage is kind of your all-in-one Medicare plan. They're provided by companies with a Medicare contract. You probably see a lot of the commercials and things like that. They're only available to join during specified enrollment periods, which we'll get into. When you join a Medicare Advantage plan, this is what's going to happen for you. You will use one ID card, so you're still in Medicare. You won't use that red, white, and blue Medicare card to obtain services. You'll get an individual card from the insurance companies that you'll use. So you can keep your red, white, and blue Medicare card at home, keep it somewhere safe. But as far as getting your services, you'll use the company card that you will get from the plan that you join. The plan provides all Part A hospital and Part B medical coverage, plus other medically necessary services. When you join a Medicare Advantage plan, much of the cost of these programs is provided through a government contract. Premiums are generally lower than a Medicare supplement plan or private health plans. So we'll get into the Medicare supplement plans a little later. And like it says, Blue Cross of Idaho, for example, has a contract with Medicare to provide you these important Medicare options. There's different types of Medicare Advantage plans. You may be familiar with the HMO or PPO concepts. Generally with an HMO, you choose a provider, a primary care provider. And generally you're not able to go out of the network for services, obviously, unless it's an emergency or in cases where there's not a provider within the network that can provide the emergency service that you need. Moving into the PPO, Preferred Provider Organization, these plans, the PPO plans, they have a network of providers that you can use and you can get discounts from. But then you also have the option as well to go outside the network, which can be nice for a lot of people. You might pay a little bit more for going outside the network, but at least you will have that option. Then private fee for service, where you can see any provider who accepts plan terms or special needs plan where membership is limited. But for the most part, a lot of the Advantage plans fall under the HMO or the PPO structure. So let's look at some of the important dates. What happens to you at age 65? Automatic enrollment in Part A if you have Social Security or Railroad retirement benefits. If you don't have those, then you must manually enroll in Part A. Enroll in Part B if you have Social Security or Railroad benefits. If you don't enroll, you must prove that you have creditable coverage, and a penalty may apply for those who don't enroll. So you'll want to make sure that you're all set up to have your Part A and Part B starting at the correct dates. Enrolling in Medicare Advantage, so they have the initial enrollment period, which begins 3 months before your 65th birthday, covers the month of your birthday, and also gives you 3 months after your 65th birthday. You can change enrollment based on certain circumstances, and there's 3 ways to enroll. There's paper application. Nowadays, a lot of the applications are done online over the computer or by phone. You can change your enrollment annually, which is nice. With Medicare Advantage plans, you're not signing your life away to this one plan for the rest of your life. You have the enrollment period every year where you can make some adjustments, you can change plans and things like that. This is just again what we said, switching Medicare plans, Advantage plans is allowed during the annual enrollment. During that fall period, from the middle of October to the beginning of December, which we lay out here. Starting on October 1st, you can start to receive plan information for the coming year. And then October 15th is when the enrollment can start. So for example, right now we're in 2020, October 15th rolls around, and there's a different plan available that you want to get on. That's when you can enroll to start January 1st of 2021. And then December 7th is when the enrollment period ends. And then there, like we said, the choices that you made during that enrollment period become effective as of January 1st of the following year. The open enrollment period is a period where you can make changes to your plan. So this is kind of an enrollment period for those who are just on Medicare Advantage plans. It runs January 1st through March 31st. So you'll see here these 3 bullet points below what you can do during this time. You can drop current Medicare Advantage plan. So you can drop your current Medicare Advantage plan and return to original Medicare, the A and B. You can add a standalone prescription drug plan, Part D, or you can switch to another Medicare Advantage plan. So maybe January rolls around and you find out maybe the plan that you had enrolled in wasn't exactly what you had hoped or wanted. You still will have that flexibility come January to make a change to a different plan. There's special enrollment periods, which we can talk about here. 4 main categories. Options to join a Part C or Part D plan at other times of the year. And like I said, these are only during special circumstances or certain circumstances. One that we've talked about is when you first become eligible for Medicare, that 3-month window, as well as the month of and 3 months following your 65th birthday. You also have a special enrollment if you're on both Medicare and Medicaid. You'll get a special enrollment if your current plan is terminated, which hopefully won't be the case, but it can happen. Or if you move to an area not served by your current plan. So maybe you move and that new county that you're in doesn't offer the plan you were on. You'll have the ability to get on a new plan that will cover you. Time for another quick poll. And now we'll move on to Medicare supplement plans. So really there's 3 choices you can have. You can stick with your Medicare Part A and B, the red, white, and blue card. You can stick with that and do nothing else. Or you can get on a Medicare Advantage plan, which is what we just talked about. Now we'll talk about this next option, which is Medicare supplements. So Medicare supplement plans are not a part of Medicare. You can join at any time of the year. Does not include prescription drug coverage. So you'll want to consider adding a Part D plan to a Medicare supplement plan to have that complete coverage. They're also known as Medigap plans, which you may have heard of. So they're offered by private insurance companies to fill the gaps in original Medicare. Most plans cover some or all of the original Medicare deductibles and co-payments. So they kind of work to fill in those gaps left by that 20% of Medicare that you're liable for. There's 10 standardized plans. The rates vary by carrier and state. Plans may provide coverage beyond standard benefits. Like we said, the Part D will have to get purchased separately. There's no network restrictions. So as long as the provider will accept Medicare, you should be good to go on a Medicare supplement. And here's some of the plans listed out. We won't go into too much detail, but if you have some questions about this, we can answer those. This will show you some of the boxes that get checked. The plans go by alphabet, so they have plan A, B, C, D, F, G, K, L, M, and N. Plan G tends to be a fairly popular one, but you can see there what is covered. These plans are going to be a lot more expensive than the Medicare Advantage plans. And so that's something to really consider is the price range on the Advantage plans compared to adding a supplement. You can be potentially paying a couple $100s to add on a supplement, whereas the Advantage plans can range anywhere from $0 to $20, and they go on up, but it's usually in that $0 to $20 range, maybe a little bit more for the Advantage plans. Enrolling in a Medicare supplement. They have an open enrollment, which begins the first of the month when you turn 65, and that continues for 6 months. You must be eligible for Medicare Parts A and B. So if you sign up during that initial, when you turn 65, there's usually no health screening and they'll accept you. But if you try to get in a Medicare supplement after that point, there's usually a health screening involved. You can switch between plans at any time. And then again, enrollment can be paper application or online through a computer if they accept it that way. Time for another quick poll here. So making your choice, which type of coverage fits your income? That tends to be a big deciding factor for a lot of people. Like I said, the Advantage plans are going to be a lot cheaper and give you great benefit. Maybe you want to go on the supplement route and pay a little more for your benefits to have that coverage. Do you travel often or need care outside the state or country that you live in? That's another thing to consider. And then also, do you prefer one doctor to coordinate your care, or do you want to see the doctor of your choice? It's another thing to think about. So Advantage versus supplement. This just goes through here and lists kind of a quick comparison. Like I said, the main things to keep in mind, you're going to pay more for a Medicare supplement. You're also going to have to add on a Part D to your supplement, whereas on the Advantage end, the Part D is generally included on most plans. And then as well, let's go down the line here. You pay a monthly premium, yes, for most plans in both cases. Office visit or service co-payments, yes, for some plans for both of those. Plan benefits can change annually. Yes, for the Medicare Advantage side, there's a chance that plans can change annually for the better or the worse. That's where it comes in handy that you have that period every year where you can make changes. The supplements generally stay the same. They're generally just going to fill the gaps of that 20% that Medicare doesn't cover. Coverage for added benefits, yes, for some plans, for each category. Like I said, some of the Advantage plans will have coverage potentially for dental, vision, and hearing that's not available to you with original Medicare. Premium amounts can change annually. On both sides, the premiums can increase or decrease each year. Guaranteed enrollment, regardless of health condition, as long as you have Medicare A and B. So regardless of if you just turned 65 or if you're in your 70s and on, you can get on a Medicare Advantage plan, no questions asked, as long as you have Part A and B. Whereas on the supplement side, you have that first 6 months where you're guaranteed to be able to get on a supplement. And after that, you'll most likely have a health screening to see if they will accept you or not. Here's some more resources. If you have any questions, like I said, I appreciate you tuning in today. Hopefully this made things a little more clear for you with Medicare. There's my phone number. Feel free to reach out anytime, either by phone or by email. Love to help answer any follow-up questions you may have, and really just help you to make the most out of your Medicare and make the best decision for you individually. So I appreciate your time, and thanks for tuning in. Have a great day.